Today we're going to be discussing the congenital defect, heterotaxy. It comes from the root words hetero, meaning different, and taxi, meaning arrangement. Heterotaxy is a rare congenital defect in which the internal organs are not arranged in the typical way. The causes and who it affects. It is due to either genetic mutations or inherited conditions, but the overall cause is not completely understood. It affects 1 in 10,000 births. It affects boys more than girls at an incidence of 2 to 1. It affects preterm babies more often, and it also affects the babies of non-white mothers more often. What it looks like. The first one is situs solitis, which is normal organ arrangement, where the right lung is trilobed and the left lung is bilobed. The heart is mostly on the right side. The liver is on the right side. The stomach is on the left, and the spleen is on the left as well. In situs inversus totalis, that is a complete mirror image of everything else going on. The left lung is trilobed, the right lung is bilobed, the heart is pointing to the right side of the body, and the liver is on the left, the stomach is on the right, and the spleen is on the left. A splenia, that is usually when there is no, they call that situs ambiguous, which is usually when the organs are in weird positions but not exactly sure where they are. And the heart is usually right in the middle of the chest, and the other organs can be arranged in other strange ways, and that is also a splenia, from meaning none, so absence of a spleen, and polysplenia, poly meaning many, many spleens. How it is diagnosed. Usually it's diagnosed during pregnancy by fetal echocardiogram or ultrasound. After birth, it can be further investigated and confirmed by X-ray, a Holter monitor which examines the rhythms of the heart, an EKG, which is also electrical rhythms of the heart, an echocardiogram, which is an ultrasound of the heart, cardiac catheterization to check out blood flow, a CT scan or MRI. These things look at rhythm and vascular dynamics and can tell the doctors what defects and type of organ placement they're dealing with. How it presents. It has an abnormal heart position, levocardia, which is the heart being on the left side of the body, dextrocardia, which is the heart being on the right side of the body, and mesocardia, where the heart is directly in the middle of the chest. There can also be holes in the septal walls, like an atrioseptal defect, a ventricular septal defect, or an atrioventricular septal defect, which is basically passageways or holes between the atria and the ventricles. There's a blockage of blood flow to the lungs, which is a pulmonary valve stenosis. There's aortic valve stenosis, and there's also coarctation of the aorta, which is a narrowing of the aorta as it goes. Transposition of the great arteries, which is the most urgent of the conditions. Children that are born with this usually have to be fixed immediately, because that means that the aorta is connected to the aorta and pulmonic valves are connected to the wrong sides of the bodies or virtually switched, whereas the deoxygenated blood is being accepted by the aorta and the oxygenated blood is being accepted by the pulmonary valves, and that's completely wrong. So that has to be corrected. But there's usually a septal hole so that some oxygenated blood mixes, but it's still not enough to sustain life for this baby. There are also abnormally connected veins and underdeveloped pumping chambers. There can be sometimes one atria, one ventricle, or just one big area, and that's not very good. It also comes with different abnormal electrical rhythms such as heart block, bradycardia, supraventricular tachycardia, and abnormal heart rhythm, or different pathways like dual AV nodes where there are 2 electrical firing stations. There are also structural lung problems. As we mentioned before, the bilobes and trilobes are flipped, and ciliation problems where they have trouble expelling mucus. There can also be no spleen, a splenia, or many, polysplenia, which can result in infection problems. There's also an abnormal twisting of the intestines because of reversal. Biliary atresia, which means blockage or scarring of the bile pathways in the body from the gallbladder or liver. There's also the liver being in the wrong location, which can cause Abernathy syndrome, which is poor circulation of liver. There are 2 major types, and one's a little more severe than the other. Right atrial isomerism, right atrial isomerism is a little more severe, and there usually are multiple defects included in this, one of them being atrial septal defects. There are problems with the valves, particularly the pulmonary valve, because of vascular delivery, not the right type of blood being delivered to the body. There's an abnormality of blood returning from lungs to the heart. It's not as oxygenated as it should be. There's a splenia, lack of a spleen, and there are other organ translations and sometimes even ambiguous placement of the organs. There's left atrial isomerism, which has septal defects as well. There are valve problems. There's a complete heart block. That means the upper electrical system of the heart does not communicate with the lower. So sometimes there can be signals being fired, but your ventricle is not receiving them. Asplenia also happens, and polysplenia is also in this as well. The symptoms of it, the cardiovascular symptoms are cyanosis, this is at birth, labored fast breathing, abnormally fast or slow heartbeat, difficulty feeding, and poor weight gain. The stomach and intestinal problems are frequent vomiting, bilious green vomiting, and in the spleen and immune system, there are frequent infections due to lack of spleens or partially functioning multispleens. In the lungs, there are frequent infections, and there are difficulty clearing mucus from the lungs. How is it treated? Because of the variations between each child, there is no set treatment plan, because each child's defects and needs vary. One thing is definitely for sure, children with heterotaxy have to follow up with and constantly see a cardiologist to make sure they're all right. They also have to take medications to support immune health, liver function, lung function, and intestinal health. Thank you for viewing this presentation.